What is trauma-informed care? Trauma-informed care, TIC, is an approach to healthcare, social services, and corrections that recognizes the widespread impact of trauma and seeks to create safe, supportive environments for healing. It acknowledges the role trauma plays in shaping an individual's behavior, decisions, and overall well-being. Specific to sex workers and survivors of sex trafficking, trauma-informed care centers their lived experiences, avoiding practices that could re-traumatize them while promoting empowerment and self-determination. For individuals intersecting with the criminal justice system, TIC recognizes how incarceration itself can exacerbate trauma, particularly for women and marginalized populations who have faced abuse, systemic oppression, and social stigmatization. The approach involves addressing both the immediate impacts of trauma and the underlying systemic inequities that perpetuate harm. Key principles of trauma-informed care. Trauma-informed care, TIC, is built on a foundation of principles that aim to create supportive, healing-centered environments for individuals who have experienced trauma. The first principle, safety, focuses on ensuring that all interactions promote physical, emotional, and psychological well-being. This involves creating spaces that are welcoming, predictable, and free from harm. For example, individuals should feel secure in their surroundings. Whether it's a healthcare clinic, shelter, or correctional facility, and interactions should avoid invoking feelings of fear or vulnerability. The principle of trustworthiness and transparency emphasizes the importance of clear communication, consistent actions, and accountability. Establishing trust requires professionals to be honest about what individuals can expect, follow through on commitments, and maintain boundaries that demonstrate respect. For trauma survivors, trust can be fragile, and transparency helps rebuild their sense of control and confidence in systems or caregivers. Peer support is another cornerstone of TIC, highlighting the value of lived experience. Incorporating the voices of individuals who have navigated similar challenges fosters a sense of understanding and connection. Peer-led initiatives such as support groups or mentoring provide relatable role models who can inspire hope and offer practical guidance, creating a supportive network that validates the survivor's experiences. The principle of collaboration and empowerment underscores the importance of involving individuals in their own care and decision-making processes. Rather than imposing solutions, trauma-informed practices seek to amplify the voices of those receiving care, respecting their autonomy and choices. This approach reinforces a sense of agency and encourages individuals to take an active role in their healing journey, which is especially important for those whose trauma has involved powerlessness or control. Cultural, historical, and gender responsiveness ensures that TIC acknowledges the diverse identities and systemic inequities that influence trauma. This principle involves recognizing how factors like race, ethnicity, gender, socioeconomic status, and historical injustices shape an individual's experiences and needs. Providing culturally competent care means tailoring services to reflect the unique contexts of those served, while also addressing potential biases within systems of care. Finally, avoiding re-traumatization is crucial to TIC. Practices and environments must be designed to prevent triggering traumatic memories or reinforcing feelings of powerlessness. For example, invasive questioning, lack of consent, or authoritarian dynamics can unintentionally replicate aspects of past trauma. Trauma-informed care strives to create environments where individuals feel safe and respected, fostering healing rather than perpetuating harm. By adhering to these principles, trauma-informed care moves beyond addressing the symptoms of trauma to fundamentally transforming systems and interactions to promote resilience, healing, and empowerment for all individuals. Specific considerations for sex workers and sex trafficking survivors. Trauma-informed care for sex workers and survivors of sex trafficking requires a deep understanding of the unique contexts and histories of trauma they often endure. Many individuals in these groups have experienced intersecting layers of abuse, including physical violence, emotional manipulation, sexual exploitation, coercion, and systemic oppression. These experiences are frequently compounded by poverty, discrimination, and lack of access to resources, creating cycles of vulnerability that can be difficult to break. Trauma-informed care must validate these experiences without pathologizing individuals, recognizing their resilience and the structural factors that contribute to their circumstances. Survivors and sex workers benefit most from care that acknowledges the complexity of their experiences rather than reducing them to oversimplified or victimizing narratives. Avoiding stigma is essential in working with sex workers and trafficking survivors. A trauma-informed approach must distinguish between the needs of voluntary sex workers and those of individuals coerced into trafficking, avoiding the conflation of these two groups. Mislabeling all sex work as exploitation can alienate those who identify their work as consensual and legitimate. This conflation not only disempowers individuals but also risks overlooking their autonomy and personal agency. Trauma-informed care should focus on meeting people where they are, providing support and resources that align with their goals rather than imposing societal judgments or preconceived solutions. For survivors of trafficking, this means offering care that addresses their unique trauma while fostering empowerment and choice in their recovery journey. The intersection of trauma and incarceration adds another layer of complexity. Many sex workers and trafficking survivors face criminalization for behaviors directly linked to their trauma, such as survival sex or substance use. The criminal justice system often fails to account for the underlying causes of these behaviors, subjecting individuals to arrest, detention, and the prison environment, which can re-traumatize them. Strip searches, solitary confinement, and punitive interactions with correctional staff can evoke feelings of powerlessness, mirroring the dynamics of their past trauma. A trauma-informed system must recognize these re-traumatizing effects and seek alternatives to incarceration, such as diversion programs, harm reduction initiatives, and restorative justice practices that focus on healing rather than punishment. By addressing these specific considerations, trauma-informed care can provide sex workers and trafficking survivors with the tools and support they need to rebuild their lives with dignity and resilience. What is and isn't trauma-informed care? Trauma-informed care, TIC, emphasizes creating environments where individuals feel safe, respected, and empowered, especially those who have experienced trauma. In practice, this means professionals in healthcare, social services, corrections, or law enforcement must approach their work with sensitivity to the emotional and psychological needs of those they serve. For instance, a healthcare provider demonstrating trauma-informed care asks for consent before touching a patient and explains every step of a medical procedure to ensure the individual feels in control. Similarly, in correctional settings, gender-responsive policies that provide menstrual hygiene products without the need for a request, or that foster peer-led support groups, demonstrate respect for dignity and autonomy, which are central to trauma-informed practices. These approaches validate individuals' experiences and minimize the risk of re-traumatization. Social service workers practicing TIC help survivors navigate resources without judgment, respecting their autonomy even if their choices include returning to sex work. This respect for autonomy is also reflected in harm reduction programs for substance use, where services such as needle exchanges or opioid substitution therapy are offered with an understanding of the trauma that often underpins addiction. Additionally, when law enforcement officers partner with trauma-informed service providers, they can shift from punitive interactions to supportive ones, offering trafficking survivors resources and support rather than criminalizing or re-traumatizing them. In contrast, practices that disregard the principles of trauma-informed care can cause significant harm, requiring trafficking survivors to recount their trauma repeatedly to different service providers. For example, can re-traumatize individuals and erode their trust in support systems. Correctional or program practices like strip searches or solitary confinement are not trauma-informed, as they replicate the dynamics of powerlessness and violation that many survivors have previously endured. Similarly, treating sex workers solely as criminals without acknowledging the socioeconomic and systemic factors driving their circumstances dismisses their autonomy and perpetuates stigma, forcing a rescue narrative on sex workers or trafficking survivors, which assumes they lack the ability to make autonomous decisions, is another harmful practice that strips individuals of agency. Moreover, denying access to trauma-specific mental health care, substance use treatment, or reproductive health services in correctional or institutional settings undermines the recovery and well-being of individuals who have experienced trauma. Trauma-informed care is not just about the absence of harm, it actively fosters environments of respect, empowerment, and healing. The distinction between what is and isn't trauma-informed lies in whether the practices center the individual's needs, autonomy, and safety, or whether they perpetuate harm, stigma, and disempowerment. Implementing true trauma-informed care requires a systemic commitment to these principles, transforming interactions and systems to prioritize healing and respect. Addressing the intersections of trauma, sex work, and incarceration in correctional settings and anti-trafficking programs. Correctional systems and anti-trafficking programs might feel similar because both often involve law enforcement, a focus on intervention, and an attempt to address behaviors deemed harmful to individuals or society. However, they are not the same, and they shouldn't be treated as the same because their goals and approaches are fundamentally and significantly different. Correctional systems emphasize punishment and containment, whereas anti-trafficking programs should prioritize empowerment, support, and addressing systemic vulnerabilities. Conflating the two risks criminalizing survivors and sex workers, perpetuating harm rather than fostering healing and reintegration. Anti-trafficking efforts must center on trauma-informed, survivor-led practices, ensuring they do not replicate the punitive, re-traumatizing environments of correctional systems. To effectively address the intersections of trauma, sex work, and incarceration, correctional systems and anti-trafficking programs must transition from punitive models to trauma-informed, supportive approaches. For sex workers and trafficking survivors, incarceration often deepens trauma through control-based environments, isolation, and inadequate access to care. Transformative changes are essential to create systems that promote healing, empowerment, and reintegration rather than perpetuating cycles of harm and marginalization. In correctional settings, trauma-informed practices begin with creating safe, dignified environments. Eliminating practices like strip searches and solitary confinement is crucial, as they replicate the powerlessness many individuals have endured in the past and can re-traumatize them. Correctional facilities and anti-trafficking programs must prioritize clean, well-lit spaces conducive to safety and privacy, particularly for healthcare and counseling. Policies should respect dignity, such as ensuring unrestricted access to menstrual products and reducing stigmatization. Access to comprehensive mental health care is equally vital, including trauma-specific therapies like cognitive behavioral therapy, CBT, or eye movement desensitization and reprocessing, EMDR. Training staff members, volunteers, and even administration and executive leadership in trauma-informed care can reduce re-traumatizing interactions and foster a supportive atmosphere. Peer support and community connections can provide critical pathways for healing. Peer-led support groups within correctional facilities allow individuals to share experiences and build resilience, while partnerships with community organizations can offer transitional workshops that bridge the gap between incarceration and reentry. Harm reduction and rehabilitative programs should replace punitive measures for behaviors like survival sex or substance use, recognizing these as coping mechanisms rooted in trauma. Providing access to medication-assisted treatment, MAT, and other harm reduction tools is a practical step toward improving outcomes. Gender-responsive and culturally competent policies should address women's unique needs, including reproductive health care, parenting support, and care for menopause or chronic conditions. Services must also be inclusive of LGBTQ+ individuals who face additional stigmatization and discrimination. In anti-trafficking programs, respecting survivors' autonomy is paramount. Conflating consensual sex work with trafficking alienates individuals and undermines trust in support systems. Programs should empower survivors to make informed decisions about their futures rather than imposing a rescue narrative that assumes they lack agency. Non-punitive alternatives to incarceration, such as diversion programs, can redirect survivors and sex workers toward counseling, housing assistance, and job training. Advocacy for the decriminalization of survival sex is also essential to reduce incarceration for behaviors driven by systemic inequities. Comprehensive post-release support is critical to ensuring seamless transitions from correctional settings to community-based care. Survivors need access to housing, healthcare, and trauma-informed services to rebuild their lives. Legal advocacy can help individuals navigate expungement of records related to trafficking or criminalized survival behaviors. Removing barriers to reintegration. Collaborative partnerships with survivor-led organizations are key to shaping anti-trafficking strategies that reflect lived experiences. Law enforcement, healthcare providers, and social services must work together to prioritize survivor-centered interventions over punitive actions. Education and training are foundational to transforming these systems. Law enforcement, correctional staff, and anti-trafficking professionals must be trained to recognize the nuances of trauma, sex work, and trafficking, promoting understanding of systemic drivers like poverty, homelessness, and discrimination. By shifting from punishment to support and addressing root causes of exploitation, trauma-informed, gender-responsive, and survivor-centered approaches can foster healing and empowerment. These changes not only benefit individuals but also contribute to broader social justice by challenging the inequities that perpetuate cycles of trauma and incarceration. Recommendations for trauma-informed practices to address the profound intersections of trauma, sex work, and incarceration. It is essential to implement trauma-informed practices that prioritize healing over harm. Decriminalizing sex work and creating diversion programs for trafficking survivors and sex workers can reduce unnecessary arrests and incarceration, offering supportive services rather than punitive measures. Comprehensive training in trauma-informed care for law enforcement, healthcare providers, and correctional staff, guided by peer educators with lived experience, can transform interactions into opportunities for empowerment and respect. Access to gender-responsive healthcare, voluntary mental health and substance use treatment, and transitional housing programs equipped with peer-led support and harm reduction resources must be a priority. Policy reform is critical to shifting the focus from criminalization to survivor-centered support, ensuring that legal systems do not perpetuate the very trauma they aim to address. By embracing these trauma-informed recommendations, we can create pathways toward healing, empowerment, and resilience for sex workers and trafficking survivors, fostering a justice system rooted in dignity and care.